There we go. All right, now let's do this. Good afternoon, everyone. My name is Felice Turner. Welcome to the LEAD program. Thank you for joining us on your lunch hour. Today, we are going to be doing a presentation celebrating Black mamas in the disability community. The title of our presentation is Black Motherhood and Disability, Care, Access, and Joy. I am Felice Turner, and I will be joined today by TJ on the side. All right. Again, my name is Elise Turner. My pronouns are she, her, and hers. I am the lead program disability advocate. I work on our programs geared towards people of color with disabilities as well as parents of children with disabilities. I've been with this program for about 2 years now. I'm very passionate about this topic, and I'm very excited to be joining you today. And I will hand it over to my partner. Go ahead, TJ.
Hello, my name is TJ Mateo. My pronouns are she, her, and hers. I am a 2024 lead program graduate, and I have two awesome daughters. Here I have a picture of myself with my husband, who is also a graduate of the lead program in 2024.
Right, yes, and the picture on the screen is of myself, along with my two daughters, a couple years ago, kind of a flashback Friday thing, when my oldest was 6 and my youngest was 8 months. All right, so welcome and thank you for joining us. We welcome questions. Please feel free to ask questions during our presentation. We will also have time at the end for questions. Please feel free to unmute, raise your hand, or type in the chat. We do have somebody moderating the chat for us. And also feel free to rename yourself. Add your preferred pronouns. This will definitely help our chat moderator as they're going through the chat. The image on the screen is of a purple question mark. All right, so access needs. We have an ASL interpreter and live captioning being typed. This presentation is being recorded and will be streaming live on Facebook. We will also upload our presentations to our YouTube channel. We will send slides and the link to this recording to all that are registered. The image on the screen is an image of a brown-skinned person signing the word hello. What will we go over today? So today we are going to be focusing on an overview of MDRC and our lead program. We're going to start out by telling our stories as Black mamas with disabilities and Black mamas of children with disabilities. We're going to get into a conversation about intersectionality and its relationship with Black motherhood. Then we'll get into a conversation about Black maternal health care for women and infants with disabilities. And then we'll talk about some recommendations for improving Black maternal health care. The image on this screen is of a checkmarked agenda with boxes. One has a check mark in it, and above the agenda is a light bulb. Right, so MDRC's mission. MDRC, Michigan Disability Rights Coalition, cultivates disability pride and strengthens the disability movement by recognizing disability as a natural and beautiful part of human diversity while collaborating to dismantle all forms of oppression. The image on the screen is an image of our MDRC logo with white letters against an orange background. Right, and our MDRC leadership team family. So we like to talk about the fact that we are an organization and a team that is for people with disabilities, by people with disabilities, meaning not only are our programs centered on the disability community, but all of our trainings are facilitated by people with disabilities. On the screen is an image of our director, Agent A. Thomas, our program facilitator and assistant director of our LFI team, Laura Hall, Frank Vaca, who is the LFI coordinator, myself, again, disability advocate for the lead team, Also, Priscilla Cano is our bilingual advocate for our leadership programs. And we round out the group with Robbie Rinkus. She is our programs coordinator. Right? And then let's talk a little bit about the LEAD program. So, LEAD stands for Leadership, Engagement, and Advocacy Development. The LEAD program provides communities of color with increased access to disability education and resources to account for the significance of institutionalized oppression and white supremacy on their outcomes. Our goal is to empower people of color with disabilities and their parents through training and engagement opportunities. The image on the screen is an image of our 2024 parent program graduates. And if you look in the back, you will see TJ standing there. TJ and her husband were parent participants in my very first parent training. So it's great to have TJ back with us today. Right, and all of our leadership programs are funded by the Michigan Developmental Disabilities Council. That's their logo on the screen. It is a blue and green image that says MIDDC, and it has the state of Michigan centered in one of the Ds. Right, so Black Maternal Health Week. Black Maternal Health Week was founded in 2018 and officially recognized in 2021 by the Black Mamas Matter Alliance. It raises awareness of the disproportionate risk Black women face during pregnancy and childbirth. The week calls for improved care, policy change, and community action to address racial and healthcare inequities. This year's theme, Rooted in Justice and Joy, centers both the urgent need for systematic accountability and the celebration of Black mothers' resilience, collective care, and the right to thrive, not just survive. So thank you all for joining us this week. I know it's the end of the week. If you're like me, you have been doing your best to attend any of the events going on this week. Michigan, the state of Michigan, and Detroit had a couple today. I know the organization Mother and Justice has been doing work this week. I've been attending the virtual events for BMMA. So it has been a wonderful week of celebration of Black motherhood. And I'm just glad to be in community with you all today. The image on the screen says Black Maternal Health Week, and it is a caricature image of various Black women with disabilities, their babies, or holding their bellies because they're pregnant. Right?
What is disability? MDRC is a cross-disability organization. We support people with apparent and non-apparent disabilities. Both of my daughters are autistic, which is a non-apparent disability. Disability is more than mental and physical effects on the body. Disability is both how society interacts with the individual with a disability and how the individual interacts with society and themselves. Sometimes people don't understand when
Did TJ freeze for everyone else? TJ, you froze a little bit.
uh,
Still freezing? You good, TJ?
yeah, I can hear you. You can't hear me?
No, we can hear you now.
Okay. So sometimes people don't understand when my daughters are stimming or making noises. They're trying to self-soothe themselves. And sometimes we have to decline different outings if it's going to be something that's overstimulating. So sometimes people think that we're trying to be standoffish, but I'm just trying to protect my daughters from what I know would be a little bit too much for them. The, oh, I'm sorry, I was going to describe the image on the screen. The image on the screen is a young lady that is using a wheelchair. She has on a pair of brown pants, a red and blue shirt, and she's sitting by a window. The building blocks of pride starts with acknowledgement. Acknowledge identity, acknowledge losses, and acknowledge gifts. I acknowledge that my daughters are autistic, that their daily lives may look different from their same age peers, but I also acknowledge that their gifts and interests are above what some people may think that they should have. So I try to focus on the things that they can do instead of the things that they can't do. And in that, me doing that, it gives them a sense of pride. The image on the screen is a building with people in front of the store. It's a talk bubble that says pride, pointing to a person on a megaphone. And the people in front of the store and the nail salon have different levels of disabilities.
Okay, so now we're going to get to telling our stories and the importance of telling our stories as disabled Black mothers. So our stories matter. As Black women with disabilities, our stories are powerful. Sharing them helps people see us, hear us, and understand our lives. Our voices are often left out, but when we speak up, we break stereotypes, we build connection, we push for change. We're going to talk a lot today about connecting the bridge between disabled communities and Black and Brown communities. And one thing that I've found being a Black mother with a disability is that my voice is often left out in one space or another. So I may be in a space that I'm in a space that's present with all women with disabilities, but the experience of Black women isn't necessarily included, or vice versa. I can be in a space of Black women and the disability experience is not included. So that's a big reason why we're here today, and that is a big point that we would like to make in the space to really have that intersectional component to it. So my story, I became a mom in 2015 and again in 2021. While my OBGYN was supportive, my neurologist didn't adjust meds or coordinate care during pregnancy. I faced serious birth and postpartum challenges, including heavy bleeding, lack of breastfeeding support, and postpartum. And standard parenting advice wasn't always accessible. So a lot of my parenting routines I had to create myself to meet my needs as a disabled parent. That's something else I'm going to reiterate a lot throughout this presentation. Really talking about doing it your own way. As a woman with a disability, we're already in a space where we have to curate our own modes of being. And motherhood is no different. And oftentimes, when you engage with the rest of the world, people want to tell you how to do your motherhood, how to be a mother. That can't be the case for Black moms with disabilities because our bodies, our minds, our experiences are so unique to our own bodies. So it's really important for you to understand that it is okay to create your own routine that is most comfortable to you and to your family. That's big for me. But also the integrated care as you are going through your pregnancy journey, as you're getting ready to go on your pregnancy journey, to understand that it is important for you to find doctors that um, really are willing, excuse me, to understand your body and understand that because of your disability, it's important to stay connected to all of those within your medical group to make sure that you find doctors who your primary care physician is willing to talk to your OBGYN. Your OBGYN is willing to communicate with your neurologist or your cardiologist or your therapist or whatever your disability is to make sure that they are all speaking to each other because it really is an inclusive effort for you and your baby to thrive successfully on this journey. And the image on the screen is a photo or two photos of myself. One in 2015, I'm in a white dress with curly hair. That was at my baby shower in 2015. And then the image next to it is a photo, it's a black and white photo of me in all black with short hair, and I was doing my best to recreate the 2015 image. That's an image of me pregnant with my second daughter. All right, so what does joy as a Black mother with a disability mean to me? So, joy means loving myself as a Black woman with a disability, knowing my body and my needs are worthy of care and respect, raising my child or my children in a way that honors who we both are. And the world often focuses on struggles instead of happiness. Black mothers with disabilities, we deserve joy, not survival. And joy helps us heal, connect, and build power in our families and communities. Early on, my youngest daughter had a speech delay, and it really affected the way that we communicated with each other. For anyone, any parent who has experienced having to take their child to a speech therapist, if your experience was anything like mine, um, they encourage some form of sign language early on for your child to be able to communicate. I am partially paralyzed on my right side, so it was really hard for me um, to perform some of the ASL language that was required for us to communicate. So again, going back to the whole um, creating your own routine. I had to figure out a way to communicate with my child because verbal was a barrier for her, and sign language was a barrier for me. So we would use music or pointing at things as a way of communication. So again, that's part of creating your own routine, but that's also that piece about honoring who we both are. So my child has this barrier, but still figuring out a way um, to perform motherhood in a way that was best for her and best for me. And that, created a sense of joy because it was very depressing when I struggled trying to communicate with my daughter sometimes. And being able to find a way, and we both love music. So finding a way that we could really find joy with each other in that way was really a wonderful experience. The image on the screen is an image of my oldest. Um, we both have braids, brown-skinned women, and we are standing on the Chicago backdrop. The other image on the screen is a photo of me and my youngest. Again, I have braids. She has short curly hair. We both have huge smiles on our face. And that is a photo of us at home, just chilling, doing our everyday thing, which also brings me great joy. All right. And so parenting tips. So follow my energy. I pay attention to when I feel my best and tackle bigger tasks then. When my energy dips, I rest or do something simple. Listening to my body helps me stay balanced and keeps parenting manageable. I make my own rules. I don't stress about how parenting is supposed to look. I create routines that fit our family, our pace, and my abilities. What works for us is what matters most. And I ask for help. I have a huge tribe at home of really supportive women. Um, and in addition to that, I use assistive technology. Again, I get support from friends or from family. And I want my girls to see that asking for help is smart and normal and part of taking care of yourself. And I'm honest. I share my wins, I share my struggles, and how I prioritize rest. I also give my girls space to notice their own limits and practice taking care of themselves. It's our way of learning balance together. So again, I have a huge tribe, and even though it may seem like motherhood is something that you should be doing alone, or even though that is the message that sometimes is given to us, uh, asking for help, having a community, having a tribe, whatever that tribe looks like, family, friends, a support group, having that interdependence as a mom with a disability, it really can make a difference. And I really do stress the being honest, and the sharing my wins, sharing my struggles with my daughters. There are days where my body just isn't up to the task. And I share that with them. I let them know that today mommy needs to rest. Um, it helps them, it shows them that it's okay to rest. I think we live in a world today where rest always is not always prioritized, but rest is resistance. And so I really try to give them that peace. Right? So the intersections, disabled, Black, woman, mother, right? Intersectionality and maternal health, race, gender, and disability are not separate experiences. Black disabled women face layered discrimination, racism, sexism, ableism, especially during pregnancy, birth, and postpartum care. Uh, I think a lot of times in postpartum care, we look at the pieces, we don't look at the whole. So it's really important, especially when you are centering integrative care, to think about all the pieces of who you are or of who your client is. Not just the woman piece, but looking that that your client or that you're a Black woman, not just that Black woman piece, but a Black woman with a disability, looking at all of those intersections and really thinking about how that affects your unique experience. The image on the screen is of a Black woman who uses a wheelchair. She's holding her belly and she has curly
Belize,
hair.
we have a comment in the chat. Bonita
Okay.
said you're such an inspiration. Your determination speaks volumes and wants to thank you for sharing your story.
Thank you so much. I really do appreciate it. I really do think that sharing our stories is really what amplifies our experience and how we get change. So thank you for that. Acknowledging disability and stigma for parents. So, some stigmas that parents with disabilities often face. We often face different types of stereotypes based off of our bodies and minds. Often there is bias in healthcare, social isolation, underrepresentation, and all of these things can affect your mental health. As a person with a disability, with a physical disability, I am partially paralyzed on my right side, and that means that I don't drive. Driving has been an issue for me all of my life. It's something that I have attempted multiple times. Not only am I partially paralyzed, but I've had a history of seizures, and all of these things kind of hindered me from driving. And at the time, that really created this social isolation for me. I really felt isolated and this is before COVID, so this would be my first pregnancy, but I really felt isolated because I was not in community with other moms or other moms who looked like me. And yeah, I really felt alone for a while, which exacerbated my postpartum depression. So the image on the screen is an image of different Black women with disabilities, and they're with their babies. Right. And so why does this work matter? This work matters because that Black disabled mothers are not broken. The systems are. Centering us leads to better care for everyone. When you are fighting for liberation for Black people with disabilities, you're fighting for liberation for Black people. And centering our care really does make the community better. And maternal health justice and disability justice must be connected. So again, going back to that piece about understanding that maternal health justice organizations really need to be in community with disability justice organizations because we really are fighting for the same thing. The image on the screen is a caricature of mama holding her belly, right? And then recommendations for change. So, culturally competent medical care. Black women with disabilities deserve care that sees the whole person. Culturally competent care means providers listen without judgment, respect our race, our gender, and disability, and understand how bias and barriers affect our care. This is really huge. I feel that we need to center not only more providers that are that identify as Black or African American, but also those that have disabilities, that are familiar with our bodies, um, because that want to center disability justice. I really think that allows for a more inclusive, culturally competent medical system. The image on the screen is of a Black mama sitting on a white couch, holding her belly with a flower against it. She's against a white background. Right. So now we'll move on to Black maternal health, to the Black maternal health crisis. So I look back. The U.S. healthcare system has a long legacy of medical racism, forced eugenics, sterilization, experimentation, and neglect. Um, one great book. I'm a book lover, so I'm always going to bring up a book. One great book that really talks about the that talks about medical racism against Black women is Killing the Black Body. If anyone has ever read it, it is a phenomenal book that really talks about the uh, the racism and the injustice that have been performed against our bodies as Black women, and how those injustices really exacerbated experiences for women with disabilities, or um, were how Black women with disabilities attributed their disability. Black disabled bodies have historically been seen as disposable or unworthy of care, and but that groups like the Black Panther Party, which at the time was led by Elaine Brown, fought for community clinics and reproductive justice. Elaine Brown is a huge advocate for Black maternal health care, and she's one of the early day pioneers. The image on the screen is a black and white image of Black women. And the one of the images says justice for all women. Another is holding a sign that says stop forced sterilization. Another is holding a sign that says our bodies, our lives. Right? So the numbers speak. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, and we find that these numbers are even higher for Black women with disabilities. The image on the screen is a black and white image of a woman holding her belly. Right? The numbers speak continue. Black and Indigenous children are twice as likely to be investigated by CPS compared to their white peers. Black children are 50% more likely to be placed in foster care than white children, even if they have the same potential for subsequent maltreatment if left at home. Black families are less likely to have their children returned from foster care, and they often remain in foster care longer. The image on the screen is of a Black Lives Matter rally, and the image says Black Families Matter. The image was a Black Families Matter march in Brooklyn to defund the Administration for Children's Services, or ACS. It was dubbed the Family Police. Right?
Police,
And yes,
sorry. We have a request in the chat that you repeat the book title that discusses medical racism.
Killing the Black Body.
Thanks so much.
And so the numbers speak. Parents with disabilities, especially intellectual or developmental disabilities, face shocking high referral rates to Child Protective Services. 80% of parents with IDD or intellectual developmental disabilities will lose custody of their child, often for perceived inadequacies rather than evidence of neglect or abuse. So simply because someone misunderstands what's going on in my body, I am I'm at risk of them calling Child Protective Services on me. Not that I am in any way causing harm to my child, but just by the simple way that I look and how they perceive it. The image on the screen is of a Black mother with a disability holding her child. Right? And barriers to care. Medical racism and ableism. Pain is often dismissed or undertreated in Black patients. Medical tech and tools like fetal monitors often exclude disabled bodies from design. Clinics lack accessible equipment for exams or birthing. These are a lot of the barriers that we're currently seeing. And the image on the screen here is of a Black mom holding her baby. Right? And there are barriers to care, economic and social. So many Black disabled women face lower income employment. We have higher gaps in insurance, and often there is little to no paid leave. These issues limit access to prenatal as well as postpartum care. The image on the screen is of a Black mom feeding her baby. Right? And mistrust and technology gaps. Many Black communities have deep mistrust in healthcare based on lived history. The digital divide adds more barriers due to a lack of internet access, low tech literacy, and then accessible telehealth platforms. Even though these platforms are supposed to be more accessible for those of us with disabilities, if we don't have access to the technology, then it doesn't make a difference. The image on the screen here is of a Black mom feeding her little baby. All right, so recommendations for change, education and outreach. So we recommend that connecting Black maternal justice and disability justice provides holistic advocacy. Highlight maternal justice orgs already doing the work. Community-driven education on maternal health rights and technology access. Increase amplification of Black-led organizations promoting culturally competent and disability-inclusive care, as well as disability-centered organizations amplifying the barriers of Black mothers with disabilities. And the image on the screen is of a mom hugging her little girl. All right, and policy changes. So the Momnibus bill, I want to say was passed in the Senate, but we still have some work to do in the House. And this is the Michigan Momnibus bill. So supporting bills as well as changes to reproductive health policies, working with organizations that do work in policy and leadership, really getting yourself involved in the community that way is a great way to evoke change. The image on the screen is an image of three Black women smiling.
Now, I'm going to discuss Black maternal health justice in infants with disabilities. So, my story is I was diagnosed with polycystic ovarian syndrome when I was 12 years old, and I was told that it would be difficult to impossible for me to have children. So, around the age of 30, my husband decided that, maybe we should go talk to some doctors and see if they had some advances with the diagnosis. We found out yes that they did, but it was still a lot of invasive testing that they had to do. So we decided that we wouldn't keep going with it. After actively trying, I actually conceived naturally. And at 41, I had my eldest daughter. And 18 months later, we welcomed her sister. Because of my age, I was high risk and I had to be supported by a full medical team. By the time I did become pregnant, I had already worked in labor and delivery for 16 years. and I saw how the different providers treated patients when they came in. So I made it a point to make sure that I had a provider that I knew would listen to me, that would advocate for me. So I ended up changing doctors several times because I didn't feel comfortable until I got to a point where I actually found one that I trusted, which happened to be an African American female. And she advocated for me the entire way. Because of my age, I had to see maternal fetal medicine. I had to have consultations with different doctors, including anesthesia, because we knew that I had to have a C-section. So she made sure that she talked to the doctors even when I wasn't there in order to advocate for me. So I do appreciate that she understood what I needed. And even when I didn't know what to say or I didn't know what to do, she knew what to do. So she went ahead and she took very good care of me. So when I did have to have the C-section, I knew everyone in that room. So I didn't have any thoughts that I wouldn't come out on the other side. So I knew that I would be fine because I knew that she would take care of me. So the picture on the screen is a picture of both of my daughters. The first one on the left is my oldest daughter. She loves to cook, so she's always trying to help me cook something in the kitchen. And then the second photo on the right is my youngest daughter with her favorite people, her Sesame Street characters. And this is one of the first times I got a chance to have her sit down because she loves to sing and dance. So she sat down so I could take a picture of her. So as a Black mother of a child of two children with disabilities, joy means me embracing my daughter's big personalities. Both of them are over the top. They are always doing something. They're always into something. They always want to show me something. Like I said on the last slide, my oldest daughter loves to cook. So I bought her her own utensils for Christmas. So she'll have children's safe knives and cutting boards and different things like that so she can help me. Now, she may not eat what we're in there cooking, but she still wants to help me cook. And my youngest, I said she loves to sing and dance. So at any moment, there's a dance party that can happen. And when she's ready to have a dance party, everybody in the house has to get up and do the whole song. So if you're happy and you know it, we're gonna have to do all the claps, all the stumps, all the cheering, all the everything that goes with it. And she's gonna sing it from the first verse all the way to the end. But one thing that they know no matter what is, and yes, we have a lot of classes we have to go to, a lot of appointments we have to go to, but they know no matter what, mom will stop whatever she's doing if they want my attention. And if it's sitting in the floor, if it's singing, if it's whatever it is, if they want my attention, they know mom will stop and do exactly what it is that they want her to do. So the picture on the right is a picture of both of my girls sitting together on the sofa. They commandeer my blanket and they're sitting with their tablets, completely unaware that I want my blanket back. So my tips and hacks for motherhood is, first thing I did was I completely threw out the milestone charts because I kept comparing what they were doing to what the charts were saying, and it was making me depressed. So I just said, okay, you know what? I'm going to look at where they are, what they're doing, and that's where we're going to go from. We're not going to check off the charts and see what's happening. So with not checking off the milestone charts, I stopped comparing them to other children. I started looking to see, okay, this child is doing this, well, mine's not doing that. I stopped doing it altogether. So I started looking at what they could do, where they were. Okay, now where do we go from there? The other thing I stopped doing is forcing social interactions. So one of the biggest things with autism is that their social cues, they don't necessarily understand, okay, you should go over here and play with this child, or maybe you shouldn't be this close. So that's a lot of things that they're taught during their ABA training. So sometimes I realize that they don't necessarily want to interact with the person, not because of the autism, it's because their intuition says, I don't want to interact with this person, or they just don't feel like it. So I stopped forcing them to have social interactions and social situations. If you don't want to do it, that's fine. We can go do something else. So the other thing I also realized, because it is a lot of work, is that I needed to go ahead and give myself a moment to decompress, to relax, and to understand I'm not going to be perfect every day. So I sit down and I journal daily. I take a moment, no matter what's going on, if it's either in the morning, the middle of the day, or even in the evening, and journal and sit down and write down 3 things that I'm grateful for. It doesn't have to be big, it'd be something small. They ate their vegetables today. They didn't take each other's tablet from each other. Whatever it is, it may be something small, it may be something big, but it's 3 things that I'm grateful for. And then I write down 2 things that I like about myself. So my hair cooperated today. I found both of my shoes, whichever one it is something that will actually make me smile about myself instead of me focusing on what I didn't get done. And then I write down 1 thing that I did well. So we got to our appointments on time, or something as simple as I got up and put my clothes on. So this 1 thing that I did well, and it helps me to not focus on the things that didn't go well or something that I wanted to happen but didn't happen. So it takes the pressure off and allows me to understand that it's not going to be perfect every day, but today you did this well, and it works out great for me.
TJ, I wanted to let you know that you're getting some love in the chat.
Thank
First
you.
of all, somebody mentioned another book of interest called Medical Apartheid by Harriet A. Washington. And then some of the comments for what you shared, TJ, is yes, you have the right to change doctors, and I wonder how many of us knew that. Also, with regard to throwing out the milestone charts, uh, Bonita says good for you and for your babies. And for your emotional regulation, she also says, I love this, TJ. Replenish yourself and affirm yourself.
Yes, it does help. It helps every day because it's a lot. So we need that extra bit of push to keep moving forward. So infants with disabilities, an estimated 2.2 million children age 5 and under live with disabilities in the United States. This figure may be underestimated as many children go undiagnosed each year. There is no consistent information available on the racial and ethnic breakdown of this age group. And this particularly hits home for me because even though I knew something was different about my children, I could not get an official diagnosis until they were 2. So before that, I had to try to work it out. Like Felice said, you figure out different things on your own. What can I do? What can I say? Okay, how do we do this? What things can I test you for? What things can I ask? Because before that, there's no official diagnosis, so you don't get the official help. Misconceptions about infants. Disability can always be seen. Parents cause the disability. Infants with disabilities don't bond or communicate. Disability is a personal tragedy, and infants with disabilities will never live normal lives. Both of my children did what babies do. They grabbed their toes, they babbled, they rolled over, they pulled themselves up, just like we expect babies to do. But around 18 months, they started to miss some of the expected milestones before I threw the chart out. And once they received the diagnosis, I was able to learn what I could do to help them. So now that we know this is what's going on, my oldest daughter, she loves math, but she doesn't like to just do the numbers on paper. She needs to touch things in her hand to help her count. And so for my oldest daughter, my youngest daughter, because she does like music, that's the easiest way to help her learn something. So if there's music involved, she'll go ahead and pick up what it is you're trying to teach her faster than you just showing her on paper and just showing her the letters themselves. So she needs music to help her to understand it better. So now that, I know how to help them. Recommendations for change for infants is access to resources, integrated care, maternal health connection, anti-bias practices, policy advocacy, and disability justice lens. I strongly believe that the disparities in care is not intentional, but some providers just lack understanding of the demographic that they're working with and they're trying to serve. Because of their lack of knowledge, we have to seek out programs like this one and the LEAD program so that we can be better advocates for our children. And then that will help with the policy changes. And that will allow the providers to know that I have to look at this differently. I can't just look at it one way. We have to find another way to better care for our patients. Other recommendations I have is timely screening, culturally responsive evaluation and care, access to early intervention, EI, and inclusive environments. So another thing that helped with the diagnosis of my children is that their pediatrician was very, like, as soon as I had a question, she was able to answer my questions for me. Then she also understood that there's some testing that needed to be done so I wouldn't be dismissed. So before we had the ability to get the official diagnosis, she ordered speech therapy to get a consultation, and she also ordered a hearing exam. So those two things were done and they were in the record. So when I did go to make the appointment to have the autism testing, that was one of the first questions that they asked me. Is it possible that she has a problem with hearing? Is it possible it's a speech issue? So since we already had the consultation, when it was time to make the autism appointment, testing appointment, I wasn't dismissed. So I appreciated the pediatrician knowing before I knew that these things needed to be done so that we can get the diagnosis in a timely manner. Practicing disability pride from birth is, as a parent, we're our children's first teacher. So if they see in us that we believe in them and we affirm them, then they'll have that attitude already before they even go out into the world. So it helps shape their identity early. By embracing disability as part of a child's identity, it fosters confidence and self-worth from the very beginning. It counters stigma by challenging societal stereotypes that disability is something to fix or to hide. Parents who model disability pride create a nurturing environment where infants can thrive emotionally, socially, and cognitively. Early advocacy and programs and support networks that honor disability identity and parent advocacy, it helps to engage you as a parent and as a child so that they can feel more comfortable in their own skin. The photo on the screen is the Disability Pride flag. It's a black square with green, blue, white, yellow, and red stripes.
Hey, so we are about halfway through. It's almost 1 o'clock. So if you have to leave us soon, thank you for joining us. And we really appreciate you being here today. But for those of you who are sticking with us, let's just take a quick moment to look away from our screens, take a deep breath, stretch a little bit, maybe take a sip of water, just kind of catch our breaths for a second as we move into the second portion of the training. So, just all right. And the image on the screen is of a woman who is meditating. Her backdrop is orange with green flowers. She's in the meditation pose, traditional meditation pose. Right. So now we're going to move on to talking about how we resist shame in order to center joy as mothers in the community. So resisting shame and centering joy. Mothers in Black disabled communities live at the intersection of racism, ableism, and gendered expectations. These systems often produce shame about our bodies, our children, our parenting, and our needs. So it's really important for us to really think about the ways that we can center joy. And we're going to get into that in just a second. The image on the screen is an image of different people with disabilities. The sign that the center person is holding says disabled and here. And the photo credit is disabled and here project page. Right. So when we are resisting shame and centering joy, so shame might say, my body is a burden. You may feel as if your body is the barrier. We call that uh, that's being associated with the medical model of disability. So if your shame says my body is a burden, you might center joy by honoring your body as worthy, capable, and deserving of care. We all deserve care, are worthy of care. We're all capable of care, no matter who we are. All right. So Shane might say, I have to be strong all the time. If that is something that shame says to you, then one way that you may center joy would be allowing softness, rest, and vulnerability. Both TJ and I talked about ways that we center rest, and then just understanding that vulnerability piece, understanding that it's okay to be tired, it's okay to take rest. I always mention the strong Black woman trope. I always mention how much of a problem it is for me, especially for those of us in the Black disabled community, understanding that we don't have to be strong all the time, realizing that that is a capitalist politic that was put on us, not something that we have to abide by. So really just understanding that joy really is rest, vulnerability, and softness. So Shane might say, I shouldn't need help, but centering joy means asking for support and remembering interdependence is strength. Again, there is no problem with asking for help. I have a huge tribe that I lean on every day of the week. Here at MDRC, we value disability justice principles, and there's a principle that talks about interdependence over independence, really valuing connection and understanding that your community can help you thrive as well. So again, just really leaning on that support. Right? So Shane says, other mothers do this better. If your shame says that, then one way to center joy would be to define motherhood on your own terms. Again, both CJ and I have talked about this already, just really understanding that your routine is conducive to your life as a mother, your children's life, and your family, just your family overall. So whatever works for you, I remember having an issue with lactation and breastfeeding my first time around, and I really had to do the research because I was really depressed that I wasn't able to breastfeed for a long time, or for as long as others others do. And so for my second pregnancy, I researched and I found assistive technology that really helped me maneuver breastfeeding positions that were comfortable to me and that still worked for my child. And I didn't have that lactation care. I really didn't have it either pregnancy. So again, really figuring out your system, your way of doing things, um, is really a great way to center joy.
Mm. Another way that shame may say that this is my fault, and we do not want to associate blame one way or the other. So we never want to focus on fault. So to center joy and look at things differently, we're going to reject blame, name the truth that disability is not a punishment or failure. Then shame may also show up by saying that my child needs to be fixed. And we would look at that a different way and center that by affirming that our children inherit worth exactly as they are, that they don't need to be changed nor fixed. And then we also may think of shame as my child can't have a positive future. We would look at that a different way and center it on thinking and imagining and building futures rooted in dignity, access, and possibilities. When we do not actively resist shame, it can impact our mental and physical health, shape how we see ourselves as mothers, influence how our children see themselves, and then silence our advocacy and limit our vision for our children.
Centering joy is not ignoring struggle. It is a deliberate choice to protect our dignity, affirm disability as part of our identity and culture, to strengthen community bonds, to build power through connection, love, and rest, and to model
우리가
pride
어떻게 했지?
and possibility for our children.
아이스 너무 좋네. 매트릭스 맨날 거지 같은 공돌이만 들고.
So in conclusion, all right, so we just want to go over again some of those some of those recommendations for change. So again, focusing on policies and procedures that are inclusive of mamas and children with disabilities, making sure that we are really looking at that education and outreach portion. I didn't mention it earlier, but as part of that inclusive piece, there really needs to be more there needs to be more classes, more pregnancy classes, and prenatal classes for Black women with disabilities. There needs to be more education for doulas and learning how to handle disabled bodies as well as lactation support. I mentioned my experience with my lactation specialists and how each time it didn't really work for me. So we really need to advance education in those spaces. And these things will provide cultural shifts. So if we are really changing these procedures, then we are thinking about cultural competency, and how these cultural shifts can benefit our community. Welcoming environments, physical access, attitudinal access and programmatic access. So increasing accessibility so that our community can see feel as if we are welcome and feel as if we belong in all maternal health spaces. The image on the screen is an image, is a caricature of different Black mamas holding their bellies and holding their babies. Right. And also understanding the importance and the power of grassroots power and community response. So just knowing that despite all of these challenges that we've mentioned today, we as Black women have always organized. Community doulas, mutual aid, and Black led orgs are building healing spaces and care networks that center Black women with disabilities and Black mothers with disabilities. And disability justice advocates are pushing for care that is inclusive, affirming, and equitable of women of color. So again, understanding that at the end of the day, if we're all working together, that's really the way that we are creating systemic. Nope. And so there it is. If we are making these changes, then what we get is a change in the way society views disability, understanding that disability is natural and beautiful, that we are not disabled by our bodies, but by societal barriers and ableist attitudes. So a mix of political, economic, and cultural shifts around the way disability is perceived. The images on the screen are various images of Black people with disabilities. We have some influencers there. We have some everyday mamas. There is an image of a pretty one, which is a great book about a Black woman with a disability, a Black woman with cerebral palsy on her journey to understanding who she is. That's a great book and resources. So I wanted to provide you all with some local resources or some Michigan-based resources that are currently doing the work in maternal health justice for women with disabilities, specifically Black women with disabilities and maternal health justice. So Mothering Justice is an organization that we've worked with a couple times. They also just did this wonderful event last night, centering Black women with disabilities, Black mothers with disabilities, Voices for Birth, which is a part of the Birth Equity Project in the state of Michigan. They did a video. They have a video that talks about women of color with disabilities and their motherhood journey, barriers that we experience, recommendations for change. Nationally, there's of course BMMA, Black Mamas Matter Alliance. Not only did they advocate for the event last night through Mothering Justice, but they also did a wonderful presentation on trans families and how that community, which is another often voiceless community within motherhood spaces. Then there's also birth advocacy doulas training, or BADT. They have a course, it's a pre-recorded course that anyone can pay for to take. It's a birth and disability course teaching, intersecting, I should say, doula work with disability justice. And if you are doing work within the space of Black maternal health and disability, please reach out to us. We're always willing to work with organizations who are doing the work. All right, so thank you so much for joining us today. Please take our survey. We really do value your feedback. My contact info is down there. Police at my MDRC, but there's also our lead at mymdrc.org email. And then there is the MDRC website and MDRC contact information. We also have a QR code on the screen if you would rather access our survey that way. but we have about what is that, about 20 more minutes. Does anyone have any questions or comments that they would like to make? Feel free to take yourself off mute or put it in the chat if you like. No questions, no comments?
I actually, I do have a question. I was actually trying to get on camera. Just give me 1 second. Okay, thank you all so much for this training. I actually just had a few questions. Um, one just being if there was a part during the presentation where there was a bullet point that said culturally responsive evaluation and care, and I was just wondering if you could elaborate a little bit more on that exactly.
So when we're talking about culturally competent evaluations, we're talking about including, so I'll use an example. There was a doula initiative um, once that I was involved in, and looking at the form, there were no questions on the form that were relevant to women with disabilities. So when you are giving out information, any type of evaluations, surveys for maternal health in general, just making sure that you are including um, that piece about women with disabilities.
Okay, thank you. And then also, sorry, I wrote down the question so I wouldn't forget. I'm just going over my notes here. Um, I was wondering how we could get involved with the lead program.
So feel free to, my email is on the screen. We can also put it in the chat if you need to, but feel free to reach out to me at felice@mydrc.org, or you could also reach out to the lead at mymdrc.org. That's our general email address. So anyone from our team would respond to that. But if yes, so that would be the best way to connect with us. We also have a Facebook page, Michigan Disability Rights Coalition.
Felice, we've got a question in the chat. Iris, were you done? I'm sorry.
Yes, yes. Thank
Okay.
you.
Bonita asks, we would love for you to present to our community health workers. Um, can she contact you?
Absolutely, positively. We would love that. Send me an email and we will see what we can work out. Thank you.
And
Thank you
lots
for,
of
for joining us.
thanks. There's lots of thanks and thank you for the valuable information in the chat.
All right. Does anyone else have any questions? All right, if no one else has any questions, thank you so much for joining us. This is a huge passion of mine. So when I get to do this for the larger community, I really am excited to be in community with you all. If there are still maternal health events, Black maternal health events going on in your area, wherever you are, I highly encourage you to attend. We are better in numbers. So thank you for joining us. Thank you for wanting to support my community, to support this program. And I hope you have a great rest of your day. And I'll let TJ TJ if she has anything to say.
So thank you so much for listening to our story. No matter what, I want you to take away from it is that you are your biggest advocate for yourself and your child. Do not let anyone tell you that you cannot do something or you can't say something. If you do not feel right, like I said before, change your doctor. It doesn't matter if it's 5 times or 50 times, you can change your doctor to make sure that you are safe and you're taken care of.
Thank you all for joining us today, and I hope you have a great rest of your afternoon and have a great weekend. Thank you, everyone.
Bye.